Hi, this is Dr. A with another review video on lactic acidosis and hypoxia. Specifically looking at the ABGs. I wanted to do this because sometimes there's confusion about this. Okay, so lactic acidosis. Lactate is a byproduct of an emergency mechanism that produces a small amount of ATP when oxygen delivery is severely diminished. So usually we see this in conditions where there's impaired oxygen delivery, and you would expect to see low oxygen saturation or low PO2 concentrations in the blood. Normal ATP production will start with glycolysis, a process that does not require oxygen and produces pyruvate. And then normally pyruvate is sent through the Krebs or citric acid cycle, and then the protons generated go through the electron transport chain to produce ATP. This is simplified, and go back and review the biochemistry of that. Those two steps require oxygen. So the Krebs cycle and oxygen transport chain, that you need oxygen for this stuff to happen. When oxygen is not available, then what happens is pyruvate then is shunted into being made into lactic acid or lactate, and that is through an anaerobic process. Obviously it doesn't require oxygen, and that's why it does it when there's low oxygen, and it produces a small amount of ATP when it does that. And then the accumulation of lactic acid in the blood then is an indication of the severity of the oxygen deprivation. And usually what happens then is if you correct that with some oxygen, then eventually that lactic acid, the liver will convert it back to pyruvate, and it can go back and be made into ATP as long as oxygen is present. So, but you have to correct the problem. So there are a couple of types of lactic acidosis. So type A is the one that's associated with the hypoxic conditions such as shock, acute MI or heart attack, severe congestive heart failure, pulmonary edema or fluid on the lungs, severe asthma, or severe blood loss. So in all of these, it's because oxygen is not present. Now there is a second type that's of metabolic origin and is associated with diabetes, severe infections, leukemia, liver disease, renal disease, and toxins such as ethanol, methanol, or salicylate poisoning. So lactic acidosis is a metabolic acidosis. So it's a bicarb deficit due to the excess lactic acid produced. And so what happens is, it is in the metabolic acidosis, this is an elevated anion gap acidosis. So if you look at the anion gap, it'll be elevated, obviously. The bicarb is consumed through the buffering of all those excess hydrogen ions from all that lactic acid. And so examples of elevated anion gap acidosis are diabetic ketoacidosis, lactic acidosis, which we're talking about now, ingestion of methanol, ethylene glycol, and renal failure, uremia. The lab findings for lactic acidosis and ABG, the pH is going to be decreased, and is usually they're normal to a decreased PCO2, especially if you're having some issues with gas exchange, so with being able to get enough oxygen in. So if it's an lactic acidosis due to hypoxia, you will often have also then low PO2. And then obviously low bicarb levels. So everything is low. So if you look at your ABGs and everything is low, then you got to think metabolic acidosis, but specifically possibly lactic acidosis. You can do a test for lactic acids, and it's called a lactate, and it usually determines the severity of the patients of whether or not they get intensive care. And I have another video that covers that. And so one of the things that's often that's good to remember is if you have some of the respiratory issues like pulmonary edema or like severe asthma and stuff, you would think that acidosis would be respiratory, but that's not the case, because in respiratory acidosis you have an increased PCO2, and in these cases you will not. You'll have a normal to a decreased PCO2. So that's a very important thing to remember. All right, and that is the end of my comments on lactic acidosis and ABGs. Thank you.